Hi, this is Anna Owens with Nursing 201. This is sensorineural hearing loss. Sensorineural hearing loss is damage to the inner ear, the acoustic nerve, or both. The inner ear is the cochlea. The pathophysiology, usually it's a congenital defect, which causes destruction of the cochlea. It can also be caused by ototoxic drugs or loud noises, are the other common reasons you have sensorineural hearing loss. Clinical manifestations is they will have hearing loss. So the diagnostic test you're going to do the audiometry. You're also going to do a CT, an MRI, to see if there's any damage to the actual cochlea or any kind of tumor. You're also going to do an auditory brainstem evoked response, and that's where the patient has electrodes put on their head, very similar to an EEG. They are then exposed to noise and see if their brain reacts appropriately to the noises. The treatment for sensorineural hearing loss is going to be a cochlear implant as opposed to a hearing aid. A hearing aid only amplifies sound. If you simply amplify the sound, that's not going to help sensorineural hearing loss because that's not the problem. The sound moves through the system, it's just not registered when it gets there. So you have to have a cochlear implant. And this is, you do want to think about a pediatric patient. We know language is formed usually around the age of 2. So if a patient is identified as deaf, it is very important to hopefully get them some hearing before that age to have minimum effect on their language skills. If it's later than that, then that's when you can have some delay in speaking or problems with their linguistic ability. So let's look at a picture of the cochlear implant, and it completely bypasses the cochlea and uses its own electrical signals to stimulate the auditory nerve. So you see there is where it's basically a magnet that goes into on the side of the scalp. The tympanic membrane, the external ear canal, none of that is the problem. The problem is the cochlea. So it lets the sound move through the system and then uses that to stimulate the auditory nerve. And that's just what it looks like on an actual patient. Presbycusis, which is changes associated with aging, is one problem or one reason you can get sensorineural hearing loss. If you look on chart 51, that talks about age-related changes. Things like your pinna becomes elongated, hair in the canal becomes coarser and longer, especially in men. Cerumen is drier and impacts more easily. If you have dry impacted cerumen, would that be sensorineural or conductive hearing loss? That's conductive, right? Because that's the movement of the sound through the system. You also have the ability to lose high frequency sounds is lost first, and that comes back with problems with the cochlea. But do not assume all adults have hearing loss. A lot of adults do, but it is not all adults. Okay, not all elderly people are hard of hearing. What is a furuncle? A furuncle is an infected ear hair, which is obviously much more common in men. But that's just something that may need an I&D and some drainage and some antibiotics or some type of treatment. So pathophysiology of presbycusis is simply aging. Priority nursing care is make sure you visually are clearly visualized to the patient, same as every other hearing loss. You do want to teach them about how to clean their ear canals out, which we'll look at when we look at impacted canals. Also make sure they know how to care for any hearing aids they may have. Diagnostic tests are going to be the same as any other hearing loss. Audiometry is the first thing. Treatments would be dependent on if it's sensorineural or sensorineural or conductive, would be determined if you need a hearing aid or a cochlear implant. And then our expected outcomes is hopefully that the patient can continue to function in society. So we look at this question. The answer to this question is D, because we know furosemide is a loop diuretic, which is Lasix, and it is one of the ototoxic drugs. So a patient who has been taking an ototoxic drug for a long period of time has an increased risk of hearing loss. Which type of hearing loss would that be? Conductive or sensorineural? That's the sensorineural, because it's a problem with the cochlea, or the organ of hearing itself. That's the end of the sensorineural hearing loss. Thank you.